Hello, have you been asked whether Lyme disease has been eradicated? Well, this question came up in 1990, so I wanted to review where that thought first came up. In 1990, doctors Legigian, Kaplan, and Steer had 27 neurologic Lyme disease patients that had encephalopathy and neuropathy. Some of them got better with 2 weeks of IV Rocephin, but some did not. The authors wrote that they were concerned that they did not eradicate the organism. And that question still remains today, from 1990 to the present time. There's a debate, of course, that people are chronically ill after Lyme. As many as 1 out of 3 remain chronically ill. Some doctors have started to call this a syndrome called post-treatment Lyme disease syndrome that's felt to be related to an immune problem. My experience is that the old term chronic Lyme disease is still a better term. It implies, yes, they're chronically sick, but it opens up the possibility that there's a persistent tick-borne infection. And I have found it's very helpful to consider a tick-borne infection and look at whether retreatment or treatment for a co-infection might be helpful. By the way, in 1990, they weren't looking at a co-infection. They weren't looking at Babesia as a possible untreated factor. Now, why does Lyme disease persist even if you get treated? There's several theories that have been introduced. One is that they hide in the tissues, they shift in different forms, like they have a cell wall deficient form. There's a biofilm theory that they exist in tissue, but they're not resistant. And lastly, there's a persister state. Round body states are introduced. Now, when the standard therapy is not working with these models of round bodies, biofilms, and persisters, is that different antibiotics have been introduced based on that possible mechanism. So I wanted to review a couple of the mechanism. This persister hypothesis came about by researchers who were looking at tuberculosis. Tuberculosis could be treated, people would feel better after a month, but a few months later, a year later, 2 years later, they would get sick again. And the feeling is that the tuberculosis would typically not get sensitive or not become resistant to treatment, but that these tuberculin infections would persist, they'd persist. And so you have to deal with protocols that might be a year of 2 medicines or a year and a half of 3 medicines. So Lyme disease is based on that, using the persister hypothesis, that they don't really become resistant, they just persist. And that's what I find is a favorite mechanism that I like with regard to why I could retreat someone with the same antibiotic and they respond to that same antibiotic. Now, the biofilm hypothesis is a little more problematic in that there are biofilms in people from staph infections and strep infections. They really don't have that film, that congestion, that slime that staph and strep have when you see Lyme disease. But if you put a biofilm in a test tube, spirochetes love that type of environment. They have to study biofilms in Lyme in the test tube. The challenge is trying to find biofilms in people so they can study it. So it's an hypothesis rather than a complete conclusion. So what does this mean for patients? Many feel hope after treatment, but they relapse. There's a lot of research out now. Yes, they're sick. Yes, they're chronically sick. Yes, they can be difficult to treat. But why do doctors like myself and my colleagues in the field find that retreatment works, that maybe longer treatment works, sometimes combination treatment where you treat Lyme and Babesia? And with these various strategies is that we need more awareness that there's a problem, more awareness that there's a need to find better protocols so we don't have as many people chronically sick. I've been involved in that field since 1987. So the takeaway in this type of presentation is that chronic Lyme disease still is a problem. We need more research, and we need to have you comment if you have any thoughts on this subject. We're all talking, the need is there. So this is part of a Common Sense Lyme series in my Lyme Disease Science blog. So you can leave comments there, leave comments here in YouTube, and keep asking questions. Keep looking for underlying mechanism to explain the illness, and keep looking for various treatments that might lead to a better outcome. So thank you for joining me.